Glad you could join us. Now, the Ghana Health Service is warning that the disregard for the COVID-19 preventive protocols risks plunging the country into a third wave. Director General Dr. Kumar describes the threat as real and urges a relook at the adherence and enforcement of safety protocols. As of July 17, Ghana recorded a total of 99,734 COVID-19 cases, with 817 deaths and the country's active cases of 3,466 leave health authorities worried. Dr. Kumar has been explaining why the country is experiencing an upsurge in cases since December. We will bring you that shortly, but in the meantime, Head of Community Health at the University of Ghana Medical School, Professor Alfred Yorson, joins us live with more. Prof, good afternoon. Many thanks for your time. GHS has identified the disregard for safety protocols as one of the major reasons accounting for the country's new spike in infections and deaths. Do you agree?
Thank you very much, Daniel. I agree perfectly. It is important we all recognize that the majority of Ghanaians, the population, 31 million Ghanaians, we are a vulnerable population. We have vaccinated just around 1 million persons. And when you have waves in such pandemic, it is just a matter of time that it will get to us. We saw it in India and we've seen it in other places. Therefore, it's not surprising we are seeing what we are seeing here. So I perfectly agree with what the Director General said.
But what have we done wrong, Prof, in terms of enforcement?
Unfortunately, it looks as if most people are thinking we are okay. And even at this time, there is still the persistence of the feeling that the disease is still not real. And it is quite worrying. And to all intents and purposes, I think we should increase the level of public awareness and education. And also the national leadership that kept us on our toes, the presidential addresses. It is important we let Ghanaians know that we are at a critical time in the fight against the pandemic. The narrative in the West might be changing because they have vaccinated a huge chunk of their population. And they know even if people get infected, they might not get severely sick and their mortality rate might not go as high as it used to. We and other countries in Africa are not at that level, and we are a vulnerable population. Now, once you vaccinated sections in other areas and we are not, that is where the transmission festers and progresses in such a vulnerable population as ours. We need to take our own destiny in our own hands. It is important as individuals to recognize that we have a responsibility for our own health and safety and for that of our family and others.
Now,
so I think all the effort, the law enforcement, like we used to see, the police, fire service, all those law enforcement agencies, we should see them helping us, because if people are not complying, then we need to go a step further to ensure that we protect the vulnerable members of the population, especially our children in schools and those in the boarding houses and all that. This is the least we can do to support these vulnerable persons.
So, Prof, is your position that law enforcement must begin to crack the whip on those who do not keep to the safety protocols?
Certainly, we in public health, we always advocate for encouragement, education, and getting people to be aware of the consequences of their actions. If all this is not yielding the needed result, then we need to go a step further using legislation and getting people to comply and facing the consequences of their actions. And that is what, as we used to do, we visit places, ensure that corporate agencies, institutions have hand washing facilities, have sanitizers, ensuring that social distance or physical distances are maintained. And this we need to not only at the individual level, but at the corporate level as well. So we hold people responsible for their actions and also what they do to put other persons at risk. I think we need to begin to see that. And then the ordinary man on the street will see really we are in a difficult situation now.
Thank you very much, Professor Alfred Yosen, for joining us this afternoon, in the bulletin. Let's now listen to Dr. Patrick Kumar on the threats and how the service is strategizing to check a further spread.
Ghana has, as at July 17, 2021, recorded a total of 99,734 COVID-19 positive cases, with 817 deaths. The country's active case count of 3,466 leave health authorities worried. Director General of Ghana Health Service has been explaining why the country is experiencing an upsurge in cases since December.
The emergence of new variants with high infectivity further complicates the currently observed and currently non-adherence to COVID-19 safety protocols. Other threats include the outbreak of cases in the neighboring countries, surges in Ashanti and Greater Accra, which is the main hotspot in Ghana, low vaccination coverage so far, and the entry of the Delta variant into the Ghana, and lastly, but not the least, outbreaks in some of our schools. The threat of a third wave in Ghana is very real.
Dr. Kumar says a new proposal on funerals is being developed to curb the spread of coronavirus through social events. He spoke to the media at the end of a two-day high-level strategic meeting on COVID-19 in Kumasi.
As part of the protocols that have been designed, includes how funerals, etc., should be organized. And just like the protocol, I think it's not being adhered to not just by one group of people, but clearly many people are doing that. We are in discussions coming up with a proposal that limits the spread, that makes it safer, and whilst people still go ahead and have a funeral, we think that it's such a deep cultural thing that it is not something you can just wish away. And so we have a draft protocol that we are sharing to ensure that, how do we ensure that we still have our funerals in safety?
According to Dr. Kumar, Ghana's health system has some inherent strength, with the training of critical staff and increase of treatment centers from 2 to 70 since 2020. He, however, says a third wave of COVID-19 is imminent if the attitude of the citizenry remains unchanged.
The rise in cases is of concern to the Ghana Health Service, and this necessitated the strategic meeting of senior managers and our partners to address the increase in these cases. Our current system has some inherent strengths. Capacity for case management has been strengthened with an increase in the number of treatment centers from 2 to about 70 currently, with a treatment center in each region. Training of critical care staff and the provision of equipment has also been implemented. The establishment of the Ghana Infectious Disease Center is one. The establishment of electronic data collection system for surveillance data collection. A robust laboratory capacity from 2 in the early 2020 to 400 total currently. We also have a capacity for genomic sequencing as a country. However, all these capacity can be overwhelmed if we do not avert a third wave, especially driven by a Delta variant, which is highly transmissible.
Meanwhile, Ghana Health Service has been outlining some measures to tackle COVID-19 upsurge in the country.
We want to mobilize all our opinion leaders, our religious leaders, traditional leaders, key influencers, etc., in putting in place contextual risk communication messages for local for locations such as schools and workplaces. We will continue to scale up our testing capacity for COVID-19. We will scale up the use of antigen testing. Antigen testing will be used as part of our rapid response in locations where there are outbreaks such as schools, workplaces, and points of entry. That's our borders, our ports, etc. We will strengthen our contact tracing and quarantine isolation. On the areas of vaccine, importance of vaccine in limiting the transmission cannot be emphasized. Ghana is increasing its capacity to handle different brands of vaccine, including those that require ultra-cold storage facilities. Ghana is trying to source more vaccines to cover as many people as possible, and we'll be prioritizing hotspot areas, districts, highly populated areas, and at-risk groups, that is persons over 60 and above. Despite all these efforts, vaccine hesitancy needs to be tackled so as to ensure the maximum vaccine uptake when the vaccines are available.
From Kumasi, for Joy News, Oyinrinteria reporting.
You're live on Joy News today. Let's stay with COVID-19 because the new Delta variant, outbreaks in schools, and lack of adherence to COVID protocols have been identified as the main drivers of COVID-19 infections in Ghana. The Ghana Health Service now says the third wave is imminent. The country's cases continue to rise at an alarming speed, and the Ghana Health Service says the recent rise is of concern and has necessitated a strategic meeting of senior managers to address the issues. Let's look at the highlights of a press statement released after the meeting. Now, it begins with assessing the strength of the current system. It says capacity for case management has been strengthened with an increase in number of treatment centers from 2 to over 70 currently, with a treatment center in each region. It also says the training of critical care staff and provision of equipment has been done. There's also a Ghana Infectious Disease Center which has been established. Let's move on. Now, the establishment of an electronic data collection system for surveillance and data collection has also been done. Laboratory capacity has also increased from 2 in early 2020 to over 43 currently. And now we can do genomic sequencing. Also, there's a strong expanded program on immunization. Now, the gaps that we have that are being addressed, first of all, have to do with the disregard of COVID-19 safety protocols. In this regard, government is mobilizing opinion leaders, religious leaders, and traditional leaders, and key influencers to encourage the public. There's also contextualized risk communication measures for locations such as schools, workplaces, etc., which have been put in place. And the enforcement of adherence to COVID-19 safety protocols where appropriate, as was mentioned by Professor Alfred Yosin, the head of Department of Community Health at University of Ghana Medical School earlier. There are also gaps, I should say, in our laboratories where we are looking at scaling up testing capacity for COVID-19 and doing antigen testing as part of the rapid response in locations where there are outbreaks, like schools, workplaces, and more importantly, points of entry. Let's look at other gaps that are being addressed. There are gaps in surveillance. And here, the plan is to strengthen contact tracing, quarantine, and isolation. In case management, there's a need to continue to strengthen the capacity for case management, including oxygen supply for ventilators and what have you. There's also a request that all persons who fall ill must report to the nearest health facility for testing and appropriate treatment. Now, in terms of vaccines, Ghana is increasing capacity to handle different brands of vaccines, including those that require ultra-cold storage facilities. Ghana is also trying to source more vaccines to cover many people as possible, prioritizing hotspots, populated areas, and at-risk groups. Also, vaccine hesitancy needs to be tackled. Now, points of entry is a gap on its own. And so in this case, we are looking at recommending the use of rapid diagnostic tests at all POEs, monitoring the situation at the KIA on COVID-19 cases arriving in Ghana, and instituting appropriate measures. Also, surveillance and screening will be undertaken at seaports and landing beaches. We stay on the subject of COVID-19, and President Ekumfis has also been expressing worry about the recent upsurge in cases. He was concerned about the disregard for protocols. He spoke at Eid prayers held at Kanda in Accra yesterday.
The COVID-19 pandemic is still with us, unfortunately. And this has meant that for the second year running, we are having to hold a subdued Eid celebration. As we continue to count on the grace of God to protect our country from the ravages of the pandemic, like we have done since its outbreak, we can only minimize its health effects and avoid a full-blown third wave if we continue to be responsible and observe the safety and hygiene protocols. The recent increase in the number of infections is a source of worry for me and indeed for all Ghanaians. From the rising numbers, it is safe to conclude that we have let our guard down and we're beginning to live our lives and conduct our businesses as though we are in normal times.
Now, for the third time, Ministry of Health, Kweku Adjumai-Menu, will be appearing before the committee probing the procurement of the Sputnik V vaccines. As of last week, Friday, Mr. Menu admitted failing to seek parliamentary approval before going ahead to purchase the vaccines. Among the reasons he gave for his actions was the mounting pressure on his ministry to provide the required vaccines needed to inoculate the rest of the population who were due to take their second jabs as prescribed by health officers who were undertaking the vaccination exercise. We'll be taking you live to today's session, but before that, let's recap a bit of his submission before the committee on Friday.
Did you seek parliamentary approval before you entered into this contract?
No, please.
You did not.
Have you any such plans?
I thought she was going to have a follow-up question. I had plans to come to regularize the parliamentary approval, to seek for parliamentary approval after I've signed the contract.
Do you appreciate the fact that the pronouncement by the Supreme Court vis-a-vis the constitutional provision clearly talks about prior approval? You appreciate that?
Honorable Chair, very much so. But my frustrations to try to get a vaccine for us at the heat of our second wave, I relied on the Executive Instrument 61 that was passed by Parliament to hide behind emergency clauses that have been invoked to try to see if I could do that and come to Parliament to inform Parliament that this is what I've done and therefore need regularization. I need approval to cover it because we were in dire need of the vaccines. And I had the onus to try to procure the vaccines to vaccinate Ghanaians to protect our lives.
But the EI is subsidiary legislation.
Honorable Chair, I must be very honest with you. At the time, I have mentioned my frustration was the fact that I seriously made that error, and on hindsight, it won't happen any longer.
Mr. Minister, you are a senior member of this House, and you are aware of how we deal with emergency situations in Parliament. We have conventions and rules and regulations governing how you deal with emergency issues, i.e. appearing before the relevant committee and make a case so that the issue can be dealt with as an emergency issue. Why didn't you take advantage of that procedure?
Madam Chair, I've explained that those were not normal times, and I was seriously in the situation that couldn't make me think properly, the way you think that now I will actually address myself to the situation.
Mr. Minister, are you aware that we have dealt with issues and motions on the same day before on the floor of the House, in this House? And let me give you examples. You remember the $1.2 billion and the $100 million from the World Bank? We dealt with it the same day. Couldn't you have done that?
I could have done that, but the circumstances at the time was a little bit different.
Honorable Minister, you have laid evidence before this committee that you used your best efforts to get diplomatic channels to enable you reach the manufacturer or the Russian authority directly. Is that correct?
Yes.
You even did so by producing letters as evidence of such correspondence. Is that correct?
That's correct.
You further indicated that it was after all those best endeavors have proved futile before you dealt with the Sheikh. Is that correct?
That might not be correct. I dealt with the Sheikh before the frantic efforts to try to get the vaccines from the right source.
So, were you being untruthful to this committee when you indicated that you used your best efforts to get direct access to the manufacturer and the Russian authorities before you dealt with the Sheikh?
I can't remember I have said this anyway. What I said was that I made efforts, but I didn't just oppose the timing of the efforts that I made.
Still on COVID-19, and Deputy General Secretary of the Ghana Medical Association, Dr. Titus Bayo, says the medical facilities cannot contain situations beyond what is prevailing with the rise in COVID cases. Speaking on the Super Morning Show, Dr. Bayo warned medical staff are likely to be overwhelmed.
The reality is that the numbers are going up. We began seeing in the community, in schools, is really showing up now in the hospital, in pockets across the country, and virtually everywhere. The critical cases are going up, the severe cases are going up. Various units and departments are having to reactivate portions or isolation units that had been closed down because there were no cases. So that is what the situation is. And also we see that unlike the first wave or second time that we had it, even though the cases are going up, patients coming in don't appear to be bothered by it. It doesn't look like anybody. I mean, I'm talking of other non-COVID cases that are coming into the general hospitals. That general sense of awareness and caution about COVID appears to be gone. That's what we are seeing from the hospitals.
Right.
It's like a script being played back the third time. Our major concern is that we are going to be overwhelmed in terms of the healthcare system. We are going to get patients trying to get access to healthcare with COVID who will struggle to get access, because if the numbers continue in this same manner, sooner than later, you wouldn't get an ICU space, you wouldn't get bed when you need it most. The other thing is that we are getting health workers that are fatigued, that are morale is a bit low based on all that has happened. We send the caution and nobody minds you, and then again you are asked to go and battle. It is a call to duty, we will do it, but morale is generally low. People are feeling that, look, we've just brought this upon ourselves, something that is completely avoidable. So we are going to have a situation where we have an overwhelmed system. We have workers with morale, let me say, demotivated by the very act of some of our leaders that have to pull some last string of motivation from somewhere to battle this other threat that is facing us this time round. And then our supplies definitely are going to be running out based on the numbers that are going up. I must put on record that our situation now in terms of capacity is much better than the first time. It's much better than we were in January, February. But that notwithstanding, we shouldn't kid ourselves that we have a capacity to handle numbers beyond what we are seeing. No.
Now, Dr. Bayo said political leadership has lost the moral right to enforce the laws since they themselves have been found culpable.
The population whose attitude to this condition is now different. Yes, because we have learned some behavior which is going to be difficult to correct. That is the other dimension to this whole thing. Because when it came first, we didn't know much about it. Everybody was afraid. People were willing to comply. Then there were those that conspiracy theorists who didn't. Then a law was passed that made everybody try to follow. Even those who didn't believe it were forced to follow. Now we have a situation where those who passed the law, start to break the law, have lost every moral right to enforce the law. And therefore, now law enforcement, when we still have laws in place, those who are supposed to be enforcing the law are now appealing to people to do what they themselves are not doing. So this is the complexity of what we face. In addition to what you have mentioned, new variants, more easily transmissible, and then in a situation where the rest of the world appear to be well protected in terms of, and we are not. And then we are struggling to get a vaccine. Now, if you ask whether getting anything new from leadership, I would say no. And a big no, because anything new must come, a new attitude, a new behavior. Have we seen any new behavior that the masses can look up to and learn? No. We are still getting regional tours. We are still getting gatherings. We are still getting massive events happening. And then people will justify that. So what is the new communication here? Really, if you look at it, the same scientific facts could be used to prevent this disease or slow its growth. And that's where I say the small yes. That we don't need really very new mechanisms to overcome this disease. But we need a new attitude, because the way we have led our lives, it's demoralizing. I mean, that's the only word I can use at this moment.
Now, a health fellow with the Center for Democratic Development, CDD Ghana, Dr. Kwame Esiedu-Sapong, blamed the surge in cases on poor leadership and poor attitudes.
The issue at hand is that yesterday, there was an update of close to 1,000 cases just in 24 hours. You just need to go to the Health Service website to check. And you would know that wave or no wave, this has never happened since COVID came to Ghana. And so if you are getting that rapid updates and you are getting 300 cases a day, and I'm listening to Dr. Bayo and what he's saying, you ask yourself, does it really matter whether we are hitting a third wave, or is it more important that we start doing the things that would alter the trajectory that we are getting into, whether it's a third wave or not? And for me, what's important is to alter the trajectory, because if you listened to Dr. Bayo, capacity has gone up, but so has the number of new cases, as I said. On the other hand, behaviors have gone down, which means that there is a likelihood that if care is not taken, the pace at which patients would turn from positive cases into hospitalizations, into severe illness, and possibly death might also accelerate at the same pace. Because we have to remember that always a proportion of the positive cases are the same people who get hospitalized. A proportion of the hospitalized cases are the same people who get severely and critically ill, and a proportion of these severely and critically ill are the people who unfortunately pass. Along this ladder, there are also the people who then get what's called long COVID and chronic disease overlay. So for me, those numbers from a public health standpoint concern me more than whether we are going into a third wave or not. Yes, I know people want to run away from the fact that we are approaching a third wave. But the writing, Kojo, is clearly on the wall. Based on the numbers, based on what we are hearing from the hospitals, based on the fact that if you look at the Ghana Health Services own database on their website, our critical and severe disease numbers are gradually going up. And it's in line with these proportions that I outlaid. So that is how I'd want us to look at it.
Away from COVID, President Ekumfis says he's a defender of free speech, and that is evident in how Ghanaians are able to express their opinions publicly without any governmental suppression. Speaking during the special Eid al-Adha prayers at the National Mosque here in Accra, he urged Ghanaians not to allow persons he describes as misguided to destroy the peace of the country. We'll be hearing from him shortly, but first, here's Chief Policy Analyst at the Ghana Institute of Public Policy Options, Dr. Charles Breku-Brobe. We'll hear how he called on President Ekumfis to publicly condemn the life-threatening comments by Assin Central MP Kennedy Japon on Love FM's Erastus Asaridonko later. But first, let's hear President Ekumfis.
Let me state that I am a firm supporter of free speech. The government I lead is also a firm supporter of free speech, amply evidenced by the atmosphere of free speech prevailing in the country. However, we must all bear in mind that words can be as incendiary as guns. The Bible tells us that death and life are in the power of the tongue. All it took was the muttering of words by some irresponsible journalists, and amplified by the power of radio, to ignite the tragic genocide in Rwanda. It is important for all of us to recognize that there's only one country we call home, and that is Ghana. We must protect our way of life, in the words of the National Pledge, with all our strength and with all our hearts. We should not allow the actions and utterances of a few misguided persons to jeopardize and destroy the united Ghana we currently possess, which is the envy of many in the continent and in the world.
You're live on Joy News Today with me, Daniel Daze. Up next is business.
Hi, good afternoon. Welcome to Business. My name is Darrell Kwao. Finance Minister Ken Ofori-Atta will not present a supplementary budget during his presentation of the media review of the budget to Parliament. This is the latest that Joy Business has picked up from persons with knowledge of the presentation. George Rafe has details.
Joy Business understands that the decision was firmed up earlier this week. This is coming after some engagement with Cabinet on the media review of the 2021 budget. Just last week, we are learning that the initial plan to carry out the presentation was based on some inflows that Ghana could be getting from the IMF. They should have brought in some $1 billion. However, after a careful review, there were some uncertainties about the exact time that the funds should be coming in. Therefore, it wasn't prudent to plan with it or factor it into government's expenditure for the next half of this year. Again, government sources say the finance minister was also very particular about the budget deficit for this year and how everything must be done to ensure that they don't exceed it. The finance minister, Ken Ofori-Atta, recently told Joy Business that he is optimistic about the deficit being reduced significantly. This is due to how revenue has performed up to the middle of this year. We are learning that government is however planning to work with the current expenditure limits by ensuring that some critical projects do not suffer for this year. This is despite the fact that the minister will not be seeking additional funds to spend for the next 5 months of this year, even though it had become a practice that during the mid-year review, the finance minister seeks approval from Parliament to lay a supplementary budget. If indeed nothing changes till July 29, that is the presentation date, then the government would end this year with a total expenditure of 129 billion Ghana cedis for the financial year.
Now, Ghana's economy is expected to become the fastest growing in sub-Saharan Africa this year. That's the view of Fitch Solutions, research arm of ratings agency Fitch. Now, it is projecting a 4.8% expansion in the economy, consistent with that of the International Monetary Fund, Moody's and Standard Bank, but in sharp contrast with the World Bank, which is forecasting a modest 1.4% GDP growth rate. William Atwell is Senior Risk Analyst at Fitch Solutions in charge of Sub-Saharan Africa, and he has been speaking with Joy Business.
Ghana is considerably more upbeat, and we forecast fairly robust real GDP growth of 4.8%, which is among the highest rates for any major SSA economy. And this reflects a fairly strong consumer recovery, a second tranche of government stimulus spending, and fairly healthy export performance. Sporadic protests are likely in the coming months, notably over governance concerns, but we think these will be fairly small scale and localized, and they're unlikely to have a detrimental impact on the growth outlook. As is the case in many other SSA markets, Ghana experienced an initial rebound in growth, with real GDP rising by a steady, if not spectacular, 3.1% in Q1. But the economy has subsequently faced some headwinds.
Well, meanwhile, Data Bank Research is maintaining its forecast of GDP growth rate at between 3.9 and 4.8%, according to its latest analysis of the economy. Increased utilization of spare production capacity will sustain the recovery in the manufacturing and trade subsectors. Charles Nixon has more.
Data Bank Research said the high-frequency data shows ongoing recovery in economic activity, but the pace of recovery in aggregate or collective demand is sluggish as the post-lockdown wage growth remains restrained. Furthermore, the rising cost of production occasioned by the tax and transport fare hikes and higher fuel costs are downside risks to the expansion in manufacturing and trade. But the food harvest season in the third quarter and the main cocoa season in the fourth quarter should propel agricultural growth in the second half of the year, albeit with some risk from the unfavorable rainfall pattern across the southern sector. The economy expanded by 3.1% in the first quarter of this year, spurred by construction, manufacturing, and ICT. Data Bank Research pointed out that with the trade subsector also posting a modest growth of 2.7%, Ghana's growth pulse is gradually strengthening. Meanwhile, government will begin a gradual rollout of the 100 billion Ghana cedis Ghana Cares program from today over the medium term.
There's more business news coming up at the top of the hour on the marketplace. Up next, sports. Don't go anywhere.
Hello, good afternoon. Welcome to Sports on Joy News today with me, Muftau Nabila Abdullah. Over the years, there have been countless reports of alleged match fixing in Ghana's domestic competitions, and this menace affects the integrity of the games. These reports appear to have been substantiated in the just-ended Ghana Premier League in a match involving Ashanti Gold and Inter Allies, where a defender of Allies, Hashim Musa, was seen deliberately scoring 2 own goals for what he says was to curtail a plan to a perfect score of put out by bettors. Executive Council member of the Ghana Football Association, Randy Abe, has revealed the desire of the association to fight the menace.
For me, although I can say unfortunate, it also presents us an opportunity to demonstrate, say, we are willing and have the capacity to deal with this issue. And that is why we must take up this thing which I see as an opportunity for us and utilize it very, very well. How we deal with this matter will go a long way in giving an assurance to the corporate world, to, in fact, the entire country. So the FA is really interested and capable, working with other stakeholders to ensure, say, we deal with these issues. Because as for some day, it will come. But you see, how you deal with them always goes in your favor or goes against you. How people see you, perceive you, dealing with it. That's why I said, say, if we decide to just deal with the Interlice and Ash Gold now, it will not serve any purpose. It won't serve any purpose. It will just create the impression that we are nitpicking. But if we take advantage of this, which is what we are going to do, to try and go into all the allegations that have been made, give all those who say that they have information for us the opportunity to help us to deal with this issue, it could become an advantage for us. It might be unfair to, let's say, Hearts of Oak, if in all the matches they played, there was nothing like this. And so far, in the allegations I've heard, I have not heard anything about a game involving Hearts of Oak. So if you look at it from who's won the league, it might be unfair. But you see, if you look at it from the point of view of the competition, you have a competition. There are allegations of match fixing in that competition. It taints the competition. What did I mention? I say it taints the competition. Yes, we have a winner. We have top 4. We have relegated teams. That's it. There is no evidence to suggest, say, those positions were not without merit.
Still on issues that have affected Ghana football, some members of parliament have accused referees of fueling hooliganism in Ghana's domestic competitions with poor officiating. Sinyani East MP Ameyo Chome and Deputy Minority Chief Whip Ahmed Ibrahim claim the only solution to fighting the canker is through good refereeing. While these members said this, one member of the Parliamentary Select Committee on Sports, Kobna Woyome, says that there should be a stadium ban for hooligans. There's more in the following report. There have been countless stories about hooliganism in Ghana football since the commencement of the 2020-2021 football season that has led to brutalities on referees. Members of Parliament have taken it upon themselves to ensure the product Ghana football is sanctified. Ranking member of Parliamentary Select Committee on Sports, Kobna Mensa Woyome, has charged the Ghana Football Association and the Ghana Police Service to collaborate and eradicate what many say is a canker in the domestic game.
It's important that we adopt tougher punishments, such as banning perpetrators for life and, where necessary, long-term imprisonment and hefty fines to serve as deterrents to others. Mr. Speaker, I concede that hooliganism may not be completely eradicated in any immediate time. Nonetheless, we can do something to reduce such occurrences. I therefore suggest that there should be a private members' bill to address football offences and disorders, safety of sports grounds, sporting events, control of alcohol, etc., to keep hooligans far from the game.
Member of Parliament for Sinyani East, Kwesi Ameyo Chome, alleged that hooliganism at the match centres is caused by poor officiating.
Barring the fact that supporters will want to see their teams win, and therefore, if they are not winning, they become angry and frustrated and probably do certain untoward things. We should, as a matter of fact, also advise, counsel match officials to do what is right.
On this note, we say thanks very much for joining us for Sports on Joy News today with me, Muftau Nabila Abla. Head on to myjoyonline.com and read some more sports stories.